Everyone's Dr. Miles again, coming back at you from my home office. Frequent ask question session, do it once a week. So I get a lot of feedback from my patients that they get something out of it. So try not to run my mouth too long. I tend to kind of ramble sometimes. So I appreciate your question. Please send it over. This question is related to tummy tucks. And the question is, do you have any tips to take care of tummy tucks to make them look better? So this is really kind of a general kind of a scar kind of question for me. The tummy tuck is probably the most, I would say, feared plastic surgery procedure that we do. It's definitely a longer incision. You know, it's on the abdomen. It's something most women are very sensitive to. A lot of women are just terrified of the scar. You know, there's some bad scars out there. I feel like my scars are very good. My revision rate is extremely low. I'm very proud to say that. I take a lot of effort to give you the best scar possible. You know, there's some genetics involved with my patients that I will never be able to overcome. It's typically related to ethnicity, African Americans, Asians, Hispanics. We tend to get darker, thicker scars versus Caucasians. But regardless, you know, I do everything possible to make sure the incision line is supported and it's going to heal the best possible. You know, that comes for me as a surgeon. When that starts with is how I repair the incision. It's a foundation kind of concept. So it's kind of like a mountain, right? So the base layer is supported with with more deep, thicker sutures. Our sutures look like fishing line. So they're very, very, very thick, very hard. And they're very strong, and they last longer. So at the very bottom, more deep, deep tissue. Above that, you get a little bit thinner kind of suture material. It supports another base layer under the skin, and at the skin gets an even finer suture. And the idea is that you support the incision line that's going to last a long time. So it lasts about 4 months, typically, that all the sutures completely dissolved. They're all under the skin. There's nothing to take out. And the support kind of concept is the surface has no tension. That's the whole concept. The surface has no tension, so you get thinner scars. That's how we repair it. For me, and on top of that, what I do is I support the incision line at the surface. So I put a dermal matrix typically on the tummy. I always put a dermal matrix on the tummy tuck. It's called perineal, and so it's a medical glue combined with the plastic support mesh. So it helps support the incision line, so the skin isn't stretching when you're standing, you're walking. It's not being stretched apart. It kind of holds it together. And so again, it's all about tension support, so you get thinner scars. And that material is still on your skin for 3 weeks. It looks gross. You know, ask my patients, it looks gross, it looks ugly. But when we take it off, you have just like a line, okay? And then at the 2-month mark, we start scar therapy. So, you know, my training personally is I trained at a burn hospital where my dad was, at the Galveston Burn Hospital. And, you know, as plastic surgeons, we focus on burn care and then the reconstruction of burns. So the mainstay of burn reconstruction is silicone pressure. It's silicone, just silicone. How it kind of helps our body calm down in the scar process, we don't actually kind of know, but it works. So I'm a huge proponent of silicone therapy. I have products in my practice that I recommend that patients start using at your 2-month mark. At 2 months, typically all your incisions are healed. There's no open areas. You know, you're ready to just kind of resume life at that point. So the scar therapy I recommend is a silicone product. That's an ointment. I use that during the day. At night, I use a silicone strip. So I do that combination because it's more cost effective. So at night, the silicone strips, you know, they're reusable. If you're nice to them, you take care of them, they'll last you a year. So it's not a consumable product, so you can keep reusing it. The silicone gel is a consumable product. You have to buy more when you run out. So that's why I only use it during the day. It dries really well, it doesn't stain your clothes, and it covers your scar during the day. When you're moving, you're exercising, you're doing all kinds of stuff. And at night, when you're still, you're not moving, you're not sweating, the silicone tapes work great. They stick on your skin. You know, you sleep. You don't even know they're there. So that's what I do. The next tip is that you need to follow up with your surgeon. Okay. For me, I see my patients at 2 months, and then at 6 months. At 6 months, if we have any issue with the scars, then I might need to make some other interventions, either with injections of some kind of steroid, or I need to do something. So I'll make that decision. Sometimes I let my patients come off of scar therapy 6 months and they're doing great. Between 6 months and a year is when a scar matures. It takes a whole year. Okay, it takes a whole year for your scar to fully mature. It's remodeling, constant remodeling. between 6 months and a year, your scar typically gets lighter. Okay, so that color, that deep red or that darkness, it gets lighter between 6 and 12 months. If you're African American, you're Hispanic or Asian, it takes longer. Okay, we heal longer. That's a longer process for us. So that's kind of the nuts and bolts of getting tips for getting better outcomes for scars, for tummy tucks. Hope you learned something. I'll see you next week. Thanks.